This is your step-by-step guide to prepare for dental surgery. What you do before going under the knife can dramatically affect your recovery. Stick around for the ultimate prep guide. Hey guys, Dr. Dominik here, diving into a topic that could make or break your dental surgery outcome. It's the preparation. And it's not just about showing up on time, it's about priming your body for healing. Today, I'll guide you through nutrition and bone healing protocols that are game changers. Here's why this is so important, guys. All of you know people that had their wisdom teeth removed, or basically all of us had them removed. And we remember this as very painful. Swollen faces, big cheeks, barely able to open the mouth. Oftentimes the wound doesn't heal, which is called dry socket. Even more pain, more antibiotics, and only secondary healing. Is it possible to do this differently? Are you eager to make your dental surgery a success story? And smash that like button, subscribe, and let's embark on this pre-surgery journey together. So the preparation for every single dental surgery we're doing starts weeks and not hours before your surgery. So I will break down the steps for you guys. When you remember your own wisdom tooth surgery, or you just went to see the dentist because one of your kids needs to take their wisdom teeth out, the only thing that you usually get informed consent of is how to prepare locally against pain with applying cold, using anti-inflammatory drugs, and maybe antibiotics. But the difference is we prepare the patient weeks in advance because the preparation starts from within, and it's all about training that body systemically so it's able to build bone and teeth and tissue when the surgery arrives and not afterwards. So preparation starts weeks, not hours before your surgery. And I will break down the steps, how we do it right here. So first of all, measure your current vitamin D3 blood work. The vitamin D3 it's basically the sun hormone, but it's crucial to bring calcium back from the bloodstream into your bone and your teeth. And after every surgery, we obviously want to heal your bone, especially after wisdom tooth surgery or any sort of implantation. But also what is key for proper healing is that the body, your body or your kid's body is prepared with the right nutrients in order to be anabolic. By anabolic, I don't mean steroids. By anabolic, I mean your body is able to build tissue. By tissue, I mean bone and gum and teeth. And we can actually use science to make that body build things. So we focus on the proper nutrition first and redesign your daily regimen. So in order to prepare for your surgery, step one is always to remove any sort of stressor from your daily life, and mainly the most pro-inflammatory foods that will cause inflammation in your body. Those are, I call them the core four signals: gluten-containing grains, sugar, refined vegetable oils such as canola oil, soybean oil, safflower oil, and most conventional dairy products. So if this is covered, the next step is always to focus on which nutrients we need to build tissue, especially obviously bone if it's after wisdom tooth surgery, or if we want to have a ceramic implant osseointegrated. This is called systemic bone healing or systemic tissue healing, or being anabolic. So we have the three macronutrients: protein, carbohydrates, and fats. Don't get scared. There are healthy forms of carbohydrates and healthy forms of fats. But most important, we need to establish in step 2 a daily protein goal, which is 2 grams per kilogram ideal body weight or 1 gram per pound of ideal body weight. You can choose from the list, but mainly animal proteins are easier. For example, meat, fish, obviously quality is important. Eggs are great, but there are also plant-based sources that you can choose from. Plants are just not as foolproof, and oftentimes they don't contain all the essential amino acids, but I don't want to bore you to death here. It's most important that you have your daily protein goal. And if these nutrients are established and we have a solid food design regimen and you have learned how to think in nutrients, only then I'll discuss micronutrients with my patients, because there are a few critical ones that aid in systemic bone healing. And this is what we need. We want supreme recovery for our patients. If possible, not even a swollen cheek, not at all pain, maybe a little bit, but not a week with big swollen cheeks and looking like Rocky Balboa after a fight. We want to have this as minimal as possible. So we will use, number one, we will test and measure the current vitamin D3 blood work again on the day of surgery. As I said, preparation starts weeks, probably 4 weeks before, by measuring the initial vitamin D3 blood work. And it should be above the norm. The norm is 30 to 60 nanogram. So we want it on day of surgery over 60 nanogram per milliliter or over 150 nanomole per liter. There is a chart for this. And this sometimes, depending on where you're starting, can take up to 4 weeks. Why is vitamin D3 so important? Vitamin D3 is the sun hormone. It's actually not really a vitamin. It's a hormone that gets produced in sunlight directly on your skin, but it helps bringing calcium from the bloodstream into your bone and into your teeth. Helps also with teeth and tooth decay. So it's crucial because I don't want to have calcium in my bloodstream calcifying my arteries. I want it in the bones. So we need vitamin D3. And if we have that vitamin D3 established, it needs a couple of cofactors, which is vitamin K2 and magnesium, to bring the calcium from the bloodstream into bone and teeth. So picture this. The bloodstream is kind of like the highway. And if you take enough vitamin D3 or level is high enough, you get calcium from the kidneys and the large intestine onto this bloodstream. So like on that highway, we have calcium bricks. There's also 2 enzymes that get specifically activated by vitamin D3. They're called osteocalcin and MGP. But let's just pretend those are 2 trucks also there, and they're loaded with that calcium. In order to bring that calcium with that truck into where it should be, like the construction site, bone and teeth, we need to have a driver and a co-driver. The driver is basically the vitamin K2, and the co-driver is magnesium. There's also showing nice studies of this. And then we focus on healthy fats such as omega-3 fatty acids, which are super anti-inflammatory, a lot of antioxidants like vitamin C and all the other fat-soluble vitamins, which usually come from the right nutrition. So I'm not a fan of compensating the wrong diet with a lot of supplements, but I'm really a big fan of fine-tuning the nutrition, which is the motor, with micronutrients to make an AMG motor out of it, fine-tuned, so that the body is able to heal. So then on the day of surgery, everything is perfectly prepared and that beautiful body can just heal, and we have supported it in its innate healing capacities. Now you're armed with knowledge on how to prep your body for dental surgery through diet, hydration, and supplements. This isn't just advice, it's a blueprint for recovery that's as smooth as possible. Are you wondering about specific foods or supplements? Just drop a question below and I might cover it in a future video. Your engagement helps us all learn and grow, so thank you ever so much for this. Remember, successful dental surgery isn't just about the procedure. It's about how well you prepare. Follow these steps to set yourself up for a recovery that is faster, less painful, and more complete. If you found this guide helpful, share it with someone facing surgery soon. Stay healthy, stay informed, and I'll see you in the next video. Cheers, Dr. Dominik.